I'm Coach Tess, and today we will be focusing on digestive keywords for the CPC board examination. I always say at the beginning of my videos that when you are studying for this exam, take your time. And I'll repeat it over and over again. Take your time. Try to learn the procedures as well as the diagnostic terms, A&P, and medical terminology. A&P is your body parts. Okay, so when you're going through these questions, is best that you know the terms while you're reading it so you don't get confused, and use the back of your CPC study guide. A lot of you use it, and the materials that we use here at HealthEversity is CPC certified materials. So whatever we say or do in our classes or on our videos is CPC certified for the CPC board examination. You know, I always tell you about my book. This book is a book that I studied with to take my board examination, and I'll show you my imperfections, how I made my notes, and stuff like that. So sometimes in my book, you'll see, or in the previous videos, you will see that I highlighted the procedures in green, or I might find a word that is a procedure, I write P beside it, or A and P, and so on and so forth. So I'll show you even my imperfections, so as a student you know not to make these mistakes, and it's good that you look up the terms. All right, so let's jump right into it. Okay, so my book for students who have never watched our videos before, I basically bring the book up close to the camera so you actually can see it instead of me just talking to you. And our first word we're going to talk about is anastomosis. It's a surgical connection of two tubular structures. What that means is, for example, you have let's say you have the intestines, the small intestines, let's say the duodenum, and there is somebody that they're going to be doing maybe a gastro-rox-and-y or one of those procedures on the intestines and the stomach. A lot of the times they basically cut a part of the intestines, and remember the intestines is like a straw, is like a tube, right? And they basically cut it and then stitch it beside each other. It's kind of gross when you really think about it, but a lot of people have this procedure. So they basically sew the walls of the, let's say, the stomach with the intestines together, and so that's what they do, or they use two ends of each tube and put it together. So look it up. It's anastomosis. Anoscopy. So in digestive, you're going to be seeing a lot of scopies, right? Scopies. So you have anoscopy, you have endoscopy, you have gastroduodenum endoscopy, you have all of these things. Our proctosigmoidoscopy. So you'll see a lot of those terms. So don't be afraid when you see them. Okay, biliary is for the gallbladder. Now, you can't just say bladder, because you have the urinary bladder and the gallbladder. So you have to call them by the right name. Okay, bypass means to go around. So if you have a bypass, you know, right, A&P right here. That's not right. Right here. See, I wrote AAP when I was a student. No, that's a procedure to go around. So they basically, for example, if you're in cardiovascular, you would use another route or another vein to go around, just like they use the intestines to go around. It's the same thing. It's just a bypass. Like you have a road, and they use an alternative road. That's what the bypass is. All right. So look at the chalangography. So it's a graphy, and they are doing a recording. So look at graphy. That's a procedure. Look at the chalangio. You're gonna have problems pronouncing that too, and find fun in it. Don't be hard on yourself, okay? So pangeographic. So they're doing sorry, a recording, and they're going to do the recording of the biliary system and the pancreas. So you have to read it backwards to really make it sense. All right, cholecystectomy. Now, ectomy is a removal. Okay, so look at the ectomy, and that's what you read first. So it's a surgical removal of the gallbladder. So the ectomy shows there. All right, so you have the cholangioenteroectomy, right? Ostomy, sorry. So you have ostomy, look up the top, ectomy, and you have graphy. They're all suffixes. So if you look right here, you have ostomy, then you have cystoenterostomy. So that's how you read it. Don't read it. It sounds crazy, but that's how you really know what they're doing. So they basically put the ostomy first, and then when you put the ostomy first, you have a better idea what you're doing. Look at this one, cholelocystography, right? They're doing a recording of the gallbladder. Look at now, we're going to go colonoscopy. So now they're doing an examination. So you have scopy, look up top now, graphy, ostomy, ectomy, graphy again. So look at scopy, colonoscopy. They're doing an examination of the colon. A lot of these scope is either therapeutic, they're doing a procedure, or they do a diagnostic procedure to find out what's going on with the patient, okay? And that goes with your guidelines. So pay attention. Colonotomy. Now they're doing an opening, right? Artificial opening. Ostomy is an artificial opening. Look on the cholecystectomy up here is the same thing, okay? So you pay attention with your ostomies, all right? Conscious moderate sedation, and that is just anesthesia. Crohn's disease, that is a diagnosis. All right, the diaphragm, we discussed diaphragm when we're in respiratory, so go back and watch that video. Dilation is an expansion. So let's say even if you're in respiratory and they dilate the lady so she can have the baby, now they do an opening. All right, expansion of her uterus or vagina or cervix, they did a diverticulum. Okay, so diverticulum is like something protruding out of the intestinal wall, and that's why some people have diverticulitis. Duodenumography, now they're making a recording of the duodenum. All right. Endoscopy, inspection of the body organs. Right here, endoscopy. So you have the scopy, and then endo means within. So that's how you come up with those two words. So sometimes you might see some crazy looking words. Just break it down and you'll find out what it is. Okay, well, let's move in. All right, let's go down to see another term. All right, so you see, once you go down, so this is an ectomy. See, esophageal lectomy, excision of covering of the larynx. So now you might be saying, how is larynx in the digestive system? The digestive system and the respiratory system are neighbors, right? They are neighbors. They share the epiglottis, they share the pharynx, because remember, your digestive system is your mouth going down. Both of them use the throat, right? So now you have the epiglottis and they share the look on the pharynx, okay? Larynx, sorry. All right, fistula. Okay, fluoroscopy. I'm not going to go through all of the terms, right? I'm not going to go through all of the terms. Look at fluoroscopy, all right? Fluoroscopy is like a moving x-ray. Can you see that? Okay. Can you see the fluoroscopy? It's a procedure of interior of the body using an x-ray and the projecting using a television screen. All right. Fluorogation, fundroplasty, repair of an organ or a muscle. So some of them, so I'll move to the next page. We still have a good amount of stuff that we can maybe look through here. Gastrointestinal pertaining, so AL, right here. AL is being pertaining to, you have AL and you have and so on and so forth. So look at a lot of your common suffixes and you'll see those terms. Gastroplasty, which is a repair of the stomach. Gastrostomy. So look at this one. Gastroplasty, and then you have gastrostomy, and then your hepatography, which has to do with the liver. So you might hear heptic, which is liver. So you need to know the names of your anatomical terms. Okay. All right. Hepatography, you have a hernia, that's a diagnosis. Hypogastric, which is the lower or middle abdominal area. Ileostomy. Now that is a ostomy. We're going right here, and the ostomy has to do with your ileum. So that's a part of your small intestines. All right, ileum ostomy. Incarcerated. That has to do with an hernia. So a lot of the times when you have hernia in your digestive area, they have to basically constrict it, reduce the they do things. That's a part that's going to come on the test, and that is a key word: incarcerated. Jejunum. All right, so your small intestines is the duodenum, jejunum, and the ileum. So you have ileum ostomy, and now you have jejunum ostomy. So they're doing, one is a surgical opening. So there is an artificial opening in the jejunum. Okay, laparoscopy, scopy, and now it's a scopy that is looking at the entire abdomen. All right, lavage, you're washing out. You're going to see that on majority of the scopes that are there. So that's the first code in that scope where they're doing a lavage, where they're washing out, and a lot of it is diagnostic. So pay attention. Marsupiation, surgical procedure that creates exterior punch from the abdomen internal abscess. So they sometimes when you do that, they do it so it doesn't come back. Optum, perineal lining within the abdominal cavity. Perineoscopy, you'll see that too. Polyp, that's a key word. So a lot of these scopes, they're basically using the scope to remove polyps within the intestinal walls. Okay, there you go. Oh, proctostigmoid scopy, right? You'll see that. So they're doing a scopy of the procto and the sigmoid. That's a part of the colon and the rectum. Rectocelli, herniation of the rectal wall, reducible. A lot of the times they do that, reducible for the hernia. Okay, let's go and see what we have. And then you have the varices, and those are varicose veins, volumus. So these are some of the terms that you can find during the digestive section of your exam. If you have any questions, please subscribe. If you have a question, please send us a message. Go on our website, send us a message, as well as subscribe, comment, and tell us if you like this video and what else we can do to help you. Anyways, guess what? Have a good one.